It is our hope that by the end of Module 1, you will be able to name the core features of comprehensive school mental health, consider the role of educators and other school staff in supporting student mental health, reflect on how you are doing in supporting student mental health, what are you doing well and where are you challenged? And finally, consider the availability of mental health services and supports in your school. To begin, I would like to invite you to reflect on your own school years. Take a moment to think about who was your favorite teacher or school staff member during your K-12 school years? And what was it about them or what they did that made them your favorite? For many, the relationship and how they were treated by or how this person made them feel is often more impactful than the academic content that was taught. Think about that connection with this person as we discuss school mental health and the role that all school staff play in supporting student mental health and well-being in schools. Comprehensive school mental health should not be siloed within schools. When the needs of the whole child are addressed by considering academic, as well as social, emotional, and behavioral needs, students do better. Of students who receive mental health care, most receive them in schools. Access to and follow through with services both increase when services and supports are available in schools. Youth are 6 times more likely to complete mental health treatment in schools than in other community settings. Further, when students participate in social emotional learning programs, they have an average of 11% improvement in their academic and social functioning. And school mental health is also associated with improved school climate and school safety. There are 6 core features of comprehensive school mental health systems. The core features include educators and student instructional support personnel, multi-tiered systems of supports for all students that is trauma-informed and healing-centered, collaboration and teaming, evidence-informed services and supports, cultural responsiveness, anti-racism and equity, and finally, data-driven decision-making. I will briefly highlight each of these core features. Let's begin with the first core feature, educator and student instructional support personnel. It is essential that schools have a full array of school and district professionals, including specialized instructional support personnel who are well-trained to support the mental health needs of students. School professionals are the foundation of comprehensive school mental health systems. These professionals are referred to as specialized instructional support personnel or student support staff, and they include school psychologists, school counselors, school social workers, school nurses, and other health professionals. These individuals are the ones to do the most intensive mental health interventions and supports with students, and they rely on the help of the broader school staff to promote and support student mental health. The MTSS approach ensures that all students may access the service array, including students in both general and special education, and that all students will have exposure to universal mental health supports. The number of tiers in any MTSS can vary, though most schools employ a 3-tiered model. As a reminder, Tier 1 includes universal supports that promote mental health for all students. These activities can be implemented school-wide at the grade level and/or at the classroom level. And some examples include classroom lessons on social emotional learning and a school-wide anti-bullying campaign. Tier 2 includes early intervention supports for students experiencing mild mental health concerns. And examples here include social skills groups or grief and loss group, and a daily report card focused on mental health goals. Tier 3 is treatment services and supports that are for students who are already experiencing significant mental health concerns that are impacting their functioning. Examples include individual, group, or family therapy. The MTSS also includes professional development and support for educators and other school staff. For example, trainings on promoting mental health and identifying, supporting, and referring students with mental health concerns, and policies and programs to promote staff well-being, such as teacher well-being lounges, access to employee assistance programs, and nutrition, exercise, and other health programs. Often districts have one or two tiers that are stronger in terms of support services and staffing. Consider your own school mental health system. Take a moment to reflect. Which tier of your comprehensive school mental health system is the strongest? And which do you think needs the most improvement? The next core feature is collaboration and teaming. Collaboration and teaming among students, families, schools, community partners, and providers is essential to address the interconnected academic, social, emotional, and behavioral needs of all students. Why does this collaboration and teaming matter to school staff? Well, when teachers and other school staff partner with school employed and community partners around student mental health, they have access to more resources, strategies, and services to better support student mental health. The next core component to consider is evidence-informed support and services. Implementing evidence-based practices and emerging best practices enhances the quality of the supports and services provided to students. Why does this matter to teachers and school staff? Well, with your limited time and many demands, it is important that the support students receive and the strategies that are used in the classroom are backed by evidence. We need to make sure that we are using what works for the grade level, identities and cultures, and specific needs that are unique to the school. The next core feature is cultural responsiveness, anti-racism, and equity. In all aspects of comprehensive school mental health systems, it is critical for all school staff to consider and be responsive to the specific cultural values, beliefs, and behaviors of families and communities, and to ensure access to mental health supports and services in a manner that is equitable and reduces disparities. In addition to student-focused supports, culturally responsive and equitable approaches also consider the impacts of structures and systems that impact students, families, and communities. We will be talking a lot more about cultural responsiveness, anti-racism, and equity in later school staff sessions. The final core feature to consider is data-driven decision-making related to mental health. What is the role of teachers and school staff for data-driven decision-making? They are asked to complete many measures and to provide their input on student mental health and well-being. Frontline staff often have established relationships with students and are well aware of students' strengths and needs. They also observe students in different settings and situations and may be the first to recognize changes in student behaviors over time. The vantage point of teachers and other school staff is critical to identifying and informing what supports would be most helpful. They can also help implement and monitor the effectiveness of recommended supports.